Hi all, welcome to Rex CCRN Review 2024. Today let's review the cardiac system. This is part 1. So initially we will be looking at a few questions, how the pattern looks like in CCRN and what you have to expect, how you have to expect the questions, and then we will dig into the answers. Question number 1. Mrs. Smith is admitted to ICU for the management of low blood pressure. She is being intubated. Her parameters are blood pressure 90/60, saturation of 92, PO2 of 97 with an FiO2 of 45, hemoglobin of 11 and SVO2 is 62%. What the nurse should do first? Option A. Increase the FiO2 to 60%. Option B. Start dobutamine. Option C. Administer beta blocker. Option D. Administer nitroglycerin. The answer is option B. Start dobutamine. We'll look at a few more questions. Then we will go to the explanation. Question number 2. Mrs. Smith's saturation is 92%. SVO2 is 52%. Which of the following is most likely can cause this change? Option A. Hypothermia. Option B. Shivering. Option C. Anesthesia. Option D. Neuromuscular blockade. The answer is option B. Shivering. Question number 3. Mrs. Smith's saturation is 88%. SVO2 is 90%. Which of the following is most likely can cause this change? Option A. Normal. Option B. Sepsis. Option C. Anesthesia. Option D. Cardiogenic shock. The answer is B. Sepsis. As you know, the right atrium receives blood from superior and inferior vena cava. This is the deoxygenated blood. In VBG, one of the parameters we look at is end result oxygen delivery and its consumption. In short, this is SVO2. This is O2 sat venous. We do VBG from central venous catheters like an interjugular line or from a Swan-Ganz catheter. So the normal SVO2 is 70% and above. Usually, after the gas exchange, the oxygenated blood, which is 100%, is pumped out to the systemic circulation. So from the right ventricle, the blood is moving into the pulmonary system and the gas exchange happens where it will start to carry 100% of oxygen, and from there it will go to the left side of the heart and it will be pumping into the arterial circulation. So when it reaches into the tissues consumes around 25% of oxygen. So remaining 75% of oxygenated blood traveling back into the heart. This is a cycle and it takes only few minutes. It takes minutes only, not few minutes. It takes only minutes. When a patient is in cardiogenic shock, what is happening? So the heart cannot pump blood. The result is low cardiac output and low blood pressure. So the blood takes longer time to return. The tissue is already craving for the oxygen. So the tissue will consume more oxygen than usual. Thereby, the oxygen consumption will go more than 25%. What is the end result? The SVO2 will drop. On the other hand, look at sepsis. What is happening with the sepsis? Can you guess? What is happening here? Here the heart pumps fast. The contractility is increased. Why it's increased? To meet the oxygen demand. So the tissue is not getting enough time to consume oxygen. It runs fast. So as a result, the SVO2 will be increased. So when someone has an issue with SVO2, if arterial saturation is not declined or is unchanged, look at the contractile issue and try to solve it. Also, you have to bear in mind that if oxygen demand is decreased in conditions such as a hypothermia or after receiving anesthesia or something like a neuromuscular blockades, it is expected that the SVO2 will go high. Likewise, the SVO2 can go low also, especially when the patient is shivering, when they are in with a pain, when they have anxiety, even with some nursing interventions, your SVO2 can go drastically. So, in short, I can say that SVO2 monitoring is to monitor the mixed venous oxygen that returns to the right side of the heart after oxygenating the body. So, it will give us an insight into how oxygen is being handled and distributed and consumed in the body through the tissues. So as I said before, the high SVO2 when the tissue has a decrease in oxygen demand, the SVO2 can go high, and low SVO2 when tissue has an increase in oxygen demand, the SVO2 can go low. Let us look at heart sounds. So when is the S2 louder? Any guess? Option A, hypothermia. Option B, hypertension. Option C, left bundle branch block. Option D, pulmonary embolism. So the answer is D, pulmonary embolism. Where can you locate the S1 heart sound? It is important to know where you have to locate the heart sounds. When you are able to locate the normal sounds, then only you will be able to listen to the abnormal sounds. So option A, MCL fifth intercostal space. Option B, second intercostal space on right sternal border. Option C, second intercostal space on left sternal border. Option D, Erb's point. I know this question is a symbol. It's just to test you. So the answer is A. It's in mid-clavicular line, fifth intercostal space. So where it can be located. So here in the fifth intercostal space. So S1 is loud at apex. So when you can listen the S1 at the end of diastole, beginning of systole. Where can you locate the S2 heart sound? It's a symbol. Option A, MCL fifth intercostal space. Option B, second intercostal space on right sternal border. Option C, second intercostal space left sternal border. And option D, Erb's point. The answer is Option B. Second intercostal space on right sternal border. So where it will be? On the second intercostal space, right sternal border. So when you can listen to the S2, it will be at the end of systole, beginning of diastole. So location is very important. You should know about the location. So I remember like this ATM. So I know that aortic and pulmonic are closer. So I took off P and I remember it as ATM. So aortic, pulmonic, and T represents the tricuspid and M represents the mitral. Of course, E represents the Erb's point. So remember that the position of the heart, how the position lies. So the apex is on the bottom and base is on the heart. So you will be able to listen only S2 on the base of the heart. And S1 is on the apex of the heart, including S3 and S4. So for the high frequency sounds, you have to use the diaphragm of the stethoscope, and for the low frequency sounds, you have to use the bell of the stethoscope. So what are the normal heart sounds? A. S1 and S3, B. S2 and S3, C. S3 and S4, D. S1 and S2. It's pretty simple. So as you know, the option D. S1 and S2. When are coronary arteries perfused? The coronary arteries are perfused during diastole or during systole. Yes, it's during diastole because diastole takes longer than the systole. It takes one third more than the longer time of the systole. Now you know the basics. Now we have to test the murmurs. So select the diastolic murmur. Option A, tricuspid regurgitation. Option B, mitral regurgitation. Option C, mitral stenosis. And option D, pulmonic stenosis. What can be a diastolic murmur? It's so simple. The answer is C, mitral stenosis or mitral stenosis. So what do you mean by murmur? The murmur is the murmur when you can listen to the murmur when there is a backflow or when there is a forward flow. So through what valves? So forward flow of blood through narrow or stenotic open valves. So the valves are already open and it's very stiff and it's so narrow. So the blood cannot go easily. Or backward flow of the blood through incompetently closed valves. So there are sometimes the valves should be closed properly to prevent the backflow. If it doesn't close properly, then there will be a backward flow. So that can also cause the murmurs. When semilunar valves are open, during systole. So during systole only the semilunar valves will be open and AV valves should be closed. So during systole the AV valves means our tricuspid and our mitral valves should be closed and aortic and pulmonic valve should be open. And when it comes to diastole, the semilunar valves should be closed and AV valves should be open. This is the normal process. So usually 80% of the blood from right atrium to the ventricle will be flowed by gravity. Around 20% only needs a small pressure, that is known as atrial kick. So if it is a stiff and narrow valve, then the blood cannot move easily. So it will cause turbulence of the blood flow, that is murmur. So there is a trick to remember the systolic murmurs. So what is a systolic murmur? So systolic murmur, we know that during systole the semilunar valves are open. So the valves are already open, but what is the issue? The AV valves are closed also. So the valves those are open, that will have stenosis, and the closed valves will have regurgitation or insufficiency. It doesn't stay in the same position. So systolic murmurs. Remember that the first valve between right atrium and right ventricle is tricuspid. Then from right ventricle the blood is passing through the pulmonic valve, and remember that aortic valve comes closer to the pulmonic valve than the mitral valve. So remember TPAM. If you put S, the letter S in the middle, that means on top of P and A, and R on both sides, it indicates systolic murmur. So in systolic murmur, I would say that the pulmonic stenosis and aortic stenosis are systolic murmurs, and tricuspid insufficiency or regurgitation and mitral insufficiency or regurgitation causes systolic murmur. It makes sense? It's so simple. So same like that during diastolic murmurs also, you have to remember these TPAM and place S on the edge now. So the stenotic valves will be the tricuspid valve and mitral valve, and the regurgitated valves will be the pulmonic valve and aortic valve. So you know now TPAM and how it represents. So what does this mean? This is diastolic or systolic murmur? So this represents the systolic murmur because S is in the middle. It's a small trick to remember. Remember that mitral regurgitation causes mid-systolic click, and aortic stenosis causes harsh systolic voice. What about tricuspid regurgitation and mitral regurgitation? It's all throughout the systole. So it's known as the pan-systolic murmur. Pan-systolic murmur. This is systolic or diastolic. This one is diastolic because S is on the edge. So this is the diastolic murmur. So here you remember that mitral stenosis causes opening snap, and tricuspid stenosis and mitral stenosis are able to listen with the bell of the stethoscope because it's a low pitch. So when it is a low pitch, you have to think that the others are high pitch. So now select the systolic murmur. Let us see you are able to tackle it or not. So option A, tricuspid stenosis. Option B, aortic regurgitation. Option C, mitral stenosis. And option D, pulmonic stenosis. It's a symbol. So the answer is option D, pulmonic stenosis. So we know that S should be in the middle. PA is in the middle. So when it comes, it will be pulmonic stenosis and aortic stenosis. Select the pan-systolic murmur. Which one is all throughout the systole? Is it tricuspid stenosis, aortic regurgitation, mitral stenosis, or mitral regurgitation? I know it will be a bit confusing. If it confuses, go back and just listen to the audio again. So the answer is D. Mitral regurgitation. Select the mid-systolic plaque. Option A. Tricuspid stenosis. Option B. Aortic regurgitation. Option C. Mitral stenosis. And option D. Mitral regurgitation. Which one is the mid-systolic plaque? So the answer is D. Mitral regurgitation. Choose the opening snap. Option A. Tricuspid stenosis. Option B. Aortic regurgitation. Option C. Mitral stenosis. Option D. Mitral regurgitation. See, you did it. So what is the answer? The answer is C. Mitral stenosis. I hope you enjoyed the video. I hope you learned something from this video. If you like it, please subscribe and share it with your friends. Let everybody get the benefit. Thank you. Have a nice day.